coronavirus. I'm covered by the blood of Jesus. And I know I'm fully covered. And immediately I get back home, I know the next thing to do to wash.
They say we should sit at home, no money, no food. So I come out to see if I can see anything chop. What am I doing at home? No food, no what? Should I die of hunger?
Strict enforcement of the stay-at-home order was noticed in the Kubwa area. Most businesses were closed, with the exception of few essential ones. A lockdown on activities in Lagos, Ogun State, and the Federal Capital Territory was declared by the President on Sunday to contain the spread of the coronavirus. Providers of essential services in these states are, however, exempted from this directive. Lara Polano, CBC News, Abuja.
The ever-busy Third Mainland Bridge, Ikoyi and Lekki all dead silent and free. No street trading. All companies' gates are under lock and key. Event centers are also shut. This is not the Lagos many know. The hustle and bustle is now on compulsory holiday. Welcome to Ife, located on the north side of the Lekki Lagoon. The directive for all residents to stay at home due to coronavirus in place. The level of compliance is high here, with security agents mounting roadblocks at strategic positions. On seminars, residents dashed out to express their dissatisfaction with the order. Their anger is based on economic stimulus package by the government. The stimulus that comes in food parks is meant for the vulnerable in the state. It's aimed at cushioning the effects of the first 14-day stay-at-home directive announced by Governor Babajide Sanwo-Olu. Meanwhile, for Adekunle and friends, this is a time to bond with no idea of social distance.
Governor wa ti sọ fún wa àti president wa wọ́n ní ká jókòó sílé ká má lọ sẹ́yìn rẹ̀ nítorí àǹfààní ara wa náà ni. Àwa náà dá ìṣe kan ìjẹ́ pé láti cooperate pẹ̀lú governor àti president wa torí pé tá bá ń lọ tá bá ń bọ̀ àwọn àrùn tó wà ń ta yìí Ọlọ́run jẹ́ kó yà ní ẹnu bọ̀dù wa.
Until after the 14 days shutdown directive, anyone not on essential duty is deemed to have violated the law. On 27th of March, Governor Babajide Sanwo-Olu signed the Infectious Disease Regulation 2020 law. Section 9 of the law says any person who violates the lockdown or stay-at-home order can be arrested without warrant and can be detained for 48 hours. When the person is found guilty, the sum of 100,000 naira fine or 1 month imprisonment or 3 months community service will be served. Adedocha, Salam Adili, TBC News. Okay.
Well, Nigeria has now confirmed 4 new cases of the coronavirus, and this takes the figure to 8. According to the Nigeria Center for Disease Control, 3 cases are in the Federal Capital Territory, while 1 is discovered in Lagos. This brings the total number of confirmed cases at this time to 139, with 2 deaths recorded and 9 persons discharged. Lagos has the highest number with 82 cases. Abuja is a distant second with 28. Oyo has 8 cases, while Osun has 5. Ogun has 4 cases and Kaduna 3. Enugu, Bauchi and Edo State have 2 cases each, while Ekiti, Rivers and Benue State have recorded 1 case each. Now, the Lagos State Commissioner for Health, Professor Akin Abayomi, says 60 personnel to man the Oniko 100-bed isolation center will complete their training on Wednesday to ensure their effectiveness in the operation of the center. Addressing journalists earlier today, he said none of the confirmed cases of COVID-19 in Lagos needs ventilators, an indication that they are not in critical condition. Health correspondent Jacqueline Ogu has more details in this report.
Residents of Lagos State are daily very eager to know if the figure of confirmed cases of COVID-19 in the state is increasing or decreasing. The man with the answer to stabilize their curiosity, Professor Akin Abayomi, Lagos State Commissioner for Health, has been speaking.
Nobody has died. We have 100% survival. We discharged 8. And there's nobody on the ward that is looking like they're going to die.
The commissioner said in the state's 3 testing centers, one in Luth, the other, Mainland Hospital for Infectious Disease Control, and the third, the Nigerian Institute for Medical Research, adopted the molecular testing method against the rapid testing method because it gives more accurate medical reports. He also explained that the safety of health workers treating COVID-19 patients who should be well protected and well remunerated is not being ignored.
They have hazard allowance, insurance, and all kinds of support incentives to make sure that we're compensating for their dedication and for actually risking their lives.
The Commissioner for Health further explained that none of the students who came into Lagos from Seme-Border tested positive for COVID-19. He said they were supported to get to their destinations in the north by Governor Babajide Sanwo-Olu. Professor Abayomi also breaking down some lines about COVID-19 patients in isolation being treated shabbily.
In an isolation ward, you don't see anybody. All you see is your fellow ward mates. The doctors and the cleaning staff will come in for a very short period of time, a few times a day, and they will leave. Because the longer they stay there, the more chances are that they will get infected themselves.
The commissioner clearly stated that military action cannot be taken against children who play football instead of obeying the distance in order. For him, more enlightenment will help them do the needful. Professor Akin Abayomi is optimistic that confirmed cases in Lagos will not blow like in China, Italy, or Spain, because the lockdown order is being embraced by compliance. Lagos State Commissioner for Health has just spoken about strategies being maintained by the government to ensure that COVID-19 does not spread further in the state. On the flip side, the people of Lagos State want to see the actualization of measures that will keep them from debt. Jacqueline Ogo, TVC News, Lagos.
Still ahead on TVC News at 10, Ondo government orders total closure of markets as an antidote to the spread of COVID-19. Stay with us for details.